Welcome everyone to the second last session of our October and Beyond webinar series. I was just explaining to some participants that we've had a quick change up and you get an added bonus of a classroom ventilation calculation tool today. And our session around COVID information has been moved to next week. So you'll get to catch that then. Hope you join us. And without further ado, we will go ahead and introduce, well, actually, we may not have our first speaker just yet. I would also welcome people to share that we are having an exorbitant number of participants via Facebook Live. You're welcome to join that way as well. And as you know, our videos are available for download as well as the slides in the next week or so. So welcome. Jennifer, maybe perhaps you can go ahead and share the presentation, the first presentation, and I'll check on Melanie. And maybe Thomas, we will switch things up and have you go first.
Oh, I'm here now. I'm here.
Oh, she's here. I hear you. Good stuff. Okay, wonderful. Well, so Jennifer, you don't mind sharing those slides for Melanie, and we'll go ahead and introduce her. So our first speaker is Melanie Gormaning, and I'm so happy to have Melanie as Melanie has been at October before. She's like my partner in crime. I have been talking about a pilot project with the Silica control tool, and I don't like talking about it without the creator, one of the creators here. So I appreciate Melanie's return. Dr. Melanie Gormaning is the health and exposure scientist at the BC Construction Safety Alliance and an adjunct professor at UBC School of Population and Public Health. She's an occupational hygiene researcher with a focus on health hazards in the construction industry. She developed the Silica exposure database and model that drives the Silica control tool. So without further ado, Melanie.
So thank you for having me back again to talk about the Silica control tool. I've spoken about it, I think, at the past 2 Octobers. So I think many of you are already kind of familiar with this tool. So I'm going to run through, just as a refresher, and for anybody who hasn't seen it, just a bit of background about the tool, what it is, what it's intended to do, how it works. And then Kimberly and I are going to also talk about the pilot project that Kimberly alluded to, which is an exciting new development with the tool in Ontario. So the Silica control tool, what is it? It is an online risk assessment tool that we created for the British Columbia construction industry. Basically, we had some new regulations coming in back in 2017 that required all employers to have a written exposure control plan and have measurements to back up all the controls that they were using, and that was just very difficult for small employers to comply with. So we created this database and tool where people can access high quality occupational hygiene exposure data on Silica and use that to make decisions about controls and to create written plans. The tool creates written plans. So it creates task specific respirable crystalline silica exposure estimates for both controlled and uncontrolled common construction exposure scenarios. So we estimate exposure when no engineering controls are used, and then we estimate exposure when engineering controls are used, like local exhaust ventilation, wetting, closed cabs, that kind of thing. It's based on a linear regression model derived from over 4,500 personal exposure measurements that we've collected into a database, and these come from sampling that we've done ourselves. They come from the scientific literature, they come from government and industry databases, and they come from all over the place. They're not just from BC. So I just got a few screenshots just as a refresher to show how it works when you go in to use it. So here, this is what it looks like when you're using the tool. This is the BC version. It has drop-down menus. It guides you through an exposure assessment, and there's all drop-down menus where you select the the parameters for the work activity that you're interested in. So in this instance, I selected the material that they're using is concrete, the task they're doing is drilling, the tool they're using is an electric hammer drill. So this is a very common task in construction, but we have 15 to 20 different materials. We have a lot of different tasks, different tools. So there are some very common activities, and then there are also some less common activities in here, but we have targeted the tool towards the most common construction activities to have the biggest impact for the most employers. So once you select all the information about the exposure scenario, you can see over on the left side of the screen here, it says we're drilling concrete with a hammer drill inside for less than 4 hours. The tool uses the model that came from the database to create an exposure estimate with no control. So in this case, the uncontrolled exposure estimate would be 0.066 milligrams per cubic meter, which in BC is above our exposure limit of 0.025 milligrams per cubic meter. We have adopted the ACGI HTLV in BC. So it tells you it's a hazardous level and you need to proceed to controls. And here it gives you the option to select different controls that are available in our database. We're only able to estimate the effective controls that we do have data on, but what we have done since the tool launched is if there are new controls that people tell us about or things that are very common that we don't have in our database, there's a mechanism for people to tell us about that so that we can go out and do sampling and add it to our database. And we've been updating the tool as it launched in 2017, and we've issued about 4 or 5 updates since then. So here, there's the available controls for this activity. You can do wetting that's built into the tool, local exhaust ventilation that's built into the tool. You can here select an engineering control that's not listed. We can't estimate the effect of that control, but it at least allows you to write in what it is, and then we get that feedback, which prompts us to go and do sampling. Or you can proceed and say, no, I'm going to carry on. I'm just going to do it uncontrolled. That you have that option as well if you want, although we do discourage people from selecting that. They can select it if they're really interested in if they were going to do that, what would the exposure levels be and what kind of respiratory protection would be required. So here it gives you the controlled exposure estimate. In this case, it is 0.032 milligrams per cubic meter. I think that I didn't notice in the last slide, but I think that the control that was selected was local exhaust ventilation attached to the tool. So it's 0.032 milligrams per cubic meter. The level of dust you see has been reduced by 58% by using this control, but we're still a little bit above our exposure limit. So it's telling us we need to go on to select further controls, which in this case would be a respirator. So it is reducing the amount of ambient dust in the workplace, so that helps background people, but the worker who's actually doing the task still needs to wear a respirator. I have in the past gone through in more detail, like exactly how you do a scenario with this, but I know we've done it before at October, so I don't want to bore everybody. But just to kind of back up, the concept behind this tool is basically to make something to help employers access and use existing exposure data, especially in the case of silica. We know there's a lot of data out there. We kind of know what we need to do for silica, but for the average employer, they can't access that information because it's all in proprietary databases or behind paywalls and scientific literature. And how do they know how to interpret it? They're not industrial hygienists. So we have put it all together in an easy to use format for people so that they can access that information that is out there to make decisions. Also, it is educating employers and workers about RCS exposure and control. So just by using this tool, people are getting information about occupational hygiene best practices. They're learning about the hazards of silica exposure and how controls can help. Also, it produces effective written exposure control plans that they can use in their risk assessments. It reduces the effort and the cost for employers. So in many cases, before this existed, people just wouldn't have done anything, and now they have this, so they're able to do something because it doesn't seem so daunting. And we are, I still manage this database that is involved for the Silica control tool, so we can curate the data that's in it. We can make sure that all the data is high quality that these people are using in risk assessment. We, in BC, we launched the tool in May of 2017. All BC employers have access to it using their WorkSafe BC employer IDs. That's our local regulator in BC. We have over, the last time I looked was in July 2021, and at that time we had over 3,000 registered users. I haven't checked recently, but I'm sure it's more by now because this goes up all the time. The risk assessments created by the Silica control tool are accepted by WorkSafe BC. It's actually written into the guidelines for silica exposure or silica control in BC that this is an acceptable tool for creating risk assessments. As I said previously, it includes a mechanism for users to report work activities or a control that they would like to see added. And since launch, we've added over 400 new measurements to our database, mostly through sampling that we've carried out ourselves and with our consulting partners in BC. We partner with local hygiene consultants to do this sampling. So they kind of let us know if they're working on a project where they're going to be collecting data that could be useful for us, or we let them know if we have Silica tool users who are looking to do sampling. We have added 25 new construction tasks since we launched it in 2017. Currently, the tool can estimate exposure levels for 46 common construction tasks. So this is a slide that I like to show when I talk about the Silica tool, is the benefits of this modeled approach. So the alternative to creating this modeling tool with our database is to just create like a table. Like if you're doing drilling, this is the control you need to use. Or if you're doing grinding, this is the control that you need to use. And we did consider doing that, but I think that there are some benefits of this approach. One is that we can calibrate it easily to other jurisdictions. So all we have to do is basically go into the web tool and change the exposure limit, and then it can be oh, and also we have one of the variables in the model is tied to region. So we could go in and say, okay, now we're going to be doing this in Ontario, and it would give us a slightly different exposure estimate, and we could change the exposure limit. So then the tool would it would basically calibrate its recommendations based on the new exposure limit and the different region. Also, measurements can be pooled and used more than once. So this is generally, when people do hygiene sampling, or especially compliance sampling, they do their sampling and then they put the report in a file and they maybe use it in their own risk assessment, but nobody else ever gets access to it. In this case, we can share information across different companies. So we at the BCCSA, we collect all this exposure data anonymously. People feel comfortable sharing it with us, and then it can be used for the benefit of everybody. And with this modeled approach, we can also compare the effectiveness of different controls, which I think people have found useful when they're using the tool. We're adaptive to new technologies. We can add new controls that are invented or that we learn about. Like, for example, there's this the hollow point drill, which is a really kind of high-tech local exhaust ventilation drill that is better than normal local exhaust ventilation. We can add that to the tool, and it's rather than having to go and amend whatever table or whatever, we can just add it straight away into our database and then rerun the model. Also, we find that it encourages industry engagement. We have a lot of people getting in touch with us to tell us about, things that are missing from the tool, or things they would like to see, or things that just comments, questions. People are engaging with it. We have a hotline where people get in touch and ask questions or make suggestions, and we found that really useful. And it's really helped with just generally awareness of silica in BC.
Thanks, Melanie.
Yeah.
So yeah, that's thank you again. A good refresher for everyone, and just a reminder that we had Melanie and Hugh Davies to our previous October events, and we know this is an amazing tool. And health and safety isn't about reinventing the wheel, but about scaling and about building on the good things that we have. So we're so happy today to be able to share an advancement to this tool here in Ontario. So, and I do want to make a big shout out to our partners that make this pilot happen. Although OCAL is funding, with BC Construction Safety Association's tool, our larger partners. We also have CCOHS involved that's going to help us with some marketing of the pilot project. And we hope this tool goes nationally eventually after the pilot. So it's really helpful to get them involved. And the Infrastructure Health and Safety Association really has the networking with the construction company. So again, a reminder of the Octaz's action plan and why we thought this tool was a really good fit in the previous days. And you're going to hear more about the updates to the Octaz's action plan next Friday with Nancy and I talking about, you know, the reviewing of all this and what's going on in the province to bring it up to speed according to the Ontario Auditor General recommendations. But we know that Octaz's is an issue. We have a lot to learn, and crystalline silica, as you can see, was one of the priorities. And I led out the respiratory hazards working group where this was part of our work. Yeah, so that's just a little bit of the background as to why we went forward with this. You can. And this is a little sneak peek at next week into the prevention works, which is the Ontario Occupational Health and Safety System 5-year strategy. And you can see that the objectives align with this tool very nicely. So building and using best evidence to target the initiatives, improve OHS knowledge and practices, support workplace parties to fulfill their occupational health and safety roles and responsibilities and achieve excellence, and make OHS easier for small business, for all business, using tools. And of course, an area of system focus is occupational illness. So this coupled with a potential regulatory change to the exposure limit for silica, but it, you know, creates a no-brainer. But what we also wanted to mention is the next is the fact that, you know, we can have regulatory change, but how do we help employers comply? So for construction, I mean, the work sites change rapidly. Workers and companies are moving between sites. The tasks are varying between work shifts. There's a lack of available in-house exposure measurement and industrial hygiene expertise. So, you know, this tool helps not only if we're going to make regulatory change, how do we have people comply? And actually creates an exposure control plan for the users. And again, you'll hear more about this next week, but the group in charge, the working group in charge of updating and reviewing the occupational disease action plan had come up with objectives that align with that OHS strategy that I initially told you about. And you can see that the silica control tool, one of the big changes is marked in yellow here and is very evident, where we want to develop and share workplace tools. Well, silica control tool is an excellent example of that. It also builds strategic partnerships. Look, we're working nationally with BC Construction Safety Alliance to make this happen. It allows for research and data to be collected around occupational illness and exposure for silica. It provides training and education, and it supports any updated regulation. So you can make a regulatory change, but how do we let workers and workplaces comply with that? So here you have it. We have an Ontario pilot for the silica control tool in partnership with the BC Construction Safety Alliance, with the CCOHS and the Infrastructure Health and Safety Association. We have created a unbranded silica control tool by utilizing the BC Construction Safety Alliance tool. So what we need from you is participation. So we just kicked this off in November. Here at October, we're announcing it for Lung Month, and we are looking for construction companies, union reps, work health and safety reps, workers from small, medium, and large companies. And we're going to have them access the tool for 1 full year and survey both pre and post. So you can apply at the OCAL website, and we're looking for participants and your feedback in order to see, where we can take this type of model here in Ontario. And as Melanie's going to discuss, we'd like to, as Lisa's indicated, see this whole concept in the bigger strategy be investigated for a number of exposures and in a number of ways. So
Okay, thank you, Kimberly. Yeah, so as we've been discussing, there is potential for further development in this same vein. As we mentioned, the Silica tool is applicable in other jurisdictions. It can be used elsewhere, like in Ontario, for example, as Kimberly is working on. And the concept could be applied to other hazards. We are currently working on an asbestos tool for BC. Lead and welding fume are also possible with this kind of format, we think. I'm just, and these are just construction hazards. I'm sure they could be applicable in other industries as well. This is just an example. The BOHS in the UK, they have put together a welding fume tool that is kind of similar, where you say, what type of welding or cutting are you using? And then it goes through and tells you what control to use. It doesn't, unlike our Silica tool, it does not have a quantitative element. It doesn't give people an exposure estimate. It doesn't write up a plan. So I'm hoping that we could that is at least indicates that it's possible for welding fume, and we can do some work to maybe get maybe work collaboratively with them or make a database to I think welding fume is probably the one that is our highest priority at the moment for another tool, but I'm open to ideas as well and collaborations. Yeah, so currently in development, we have the asbestos control tool that I mentioned. And it is not actually, unlike the Silica tool, it's not based on a database. It's based on known best practices. We're also developing with the Alberta Road Builders and Heavy Construction Association. I think we have nearly completed development of an Alberta version of the Silica control tool for their members. So in that, what we did is, we changed over the model so that it's targeted to Alberta. We changed the language in the tool so that it matches the Alberta regulation rather than the BC regulation. And we reskinned it a little bit so that it has Alberta logos on it and everything now, and that will be available to their members. I'm not exactly sure when, but soon, because it's nearly ready. I'm also working with the BC Ministry of Energy, Mines and Low Carbon Innovation to create a mining specific version of the Silica control tool, because there's a lot of crossover in tasks between construction and mining. So they have been doing some sampling, and they're going to send me some of their data soon so that we can get some more mining specific stuff in there so that it can be available for mines as well, which is very exciting. And the Ontario Silica Control Tool pilot project that Kimberly has already discussed. That's everything I had to say about that. I don't know if you had more that you wanted to add, Kimberly.
yeah, I did. Just because I forgot when Melanie was speaking to mention that the timeline. So we are recruiting people for the Ontario pilot right now, all through November, and we're asking people to apply simply because we don't have an unlimited number of licenses. We would love to get access for everyone in the construction industry, but for now, we're kind of picking and choosing. So you're having applying simply because we just want to have the best sample that we can in terms of regions of Ontario, in terms of type of construction activity, some demolition, some grinding, some this, some that. We just want to make sure that we have a really good sample out there with our 60 or so licenses. So that's the reason for the application process. So please do spread the word. And I think you can tell that Melanie and I are both passionate about this approach. The Octazy's action plan, and you'll hear next week, is OCAL is very much behind, and you're going to hear that from John today and through Thomas Tencake's next presentation. Any tools that we can provide to people in workplaces to reduce exposure is really what we want to do right now. So we can, it's hard to get people aware and excited about occupational illness when there's no blood on the floor. as there may be with injury because of latency, because of so many reasons. But we know that it's not okay to be exposing people now, overexposing people now in the workplace to have them become ill later. And so we need to control exposures. We know that. With much data and evidence, and these tools are allowing that to happen with benefit for everyone. And so I guess you see that come out in, I think it's Dave Zalk, who joined us last year, calls us control bandits. Anyone who's looking for control banding or any kind of exposure or control efforts to just, we want to do something about illness, and we want to do that through exposure reduction. And it doesn't mean we have to stop training and stop making people aware, but we have to do it all at the same time, and that's what these tools do. So we're really grateful. Thanks, Melanie. I think that was all we wanted to cover. And and John's mentioning that the welding tool, another one that's only available Dutch, so that might be one for us to look at too, in addition to the British one. Melanie, are they, and if there are any questions, go ahead.
Yeah, I'm just saying, great, thank you.
Yeah. And if there are any other questions, we can take them, and if not, we can pass things over to our next speaker, sharing more tools today. Jennifer, did I miss anything while I was chatting away?
I'm just looking at the chat now. Doesn't seem like there are any questions.
Good, good. Okay, we'll spread the word, everyone. And for those 400 and some Facebook Livers out there, go tell your friends in construction in Ontario to apply on our website so we can get some participants for our pilot program. And we'll hand things over to Kevin now to introduce our next speaker. Thanks, Kevin.
Thanks,
Melanie. Thanks, sorry, Melanie. Thank you.
Thanks, everyone.
Thanks, Melanie. Just a great presentation, and it's actually interesting because we're doing a project for Health Canada at the moment where we're looking at 9 different scenarios, and one of the scenarios we're looking at actually is beryllium and welding fume. And obviously Kosh Essentials doesn't handle that, but I just see there's a great opportunity to look at a tool for welding as well. So that kind of sounds exciting work, prospect of doing that as well.